Popliteal fossa is a shallow diamond-shaped, fat-filled depression at the back of the knee joint, at the lower part of the femur and the upper part of the tibia. Its floor is formed from above downwards by the popliteal surface of the femur, the capsule of the knee joint, the oblique popliteal ligament, and the strong fascia covering the popliteus muscle. Let's discuss the boundaries of the popliteal fossa. It is bounded supralaterally by the long head of the biceps femoris and supromedially by the semimembranosus and semitendinosus. Semitendinosus has a long tendon of insertion, that's why it's called the semitendinosus. Here in pink color you can see semitendinosus, and supplemented by the gracilis, this orange color muscle gracilis, purple color muscle sartorius, and adductor magnus. Infralaterally it is bounded by the lateral head of the gastrocnemius and plantaris, and inframedially it is bounded by the medial head of the gastrocnemius. Now let's discuss the contents of the popliteal fossa. The most deep and the most medial content of the popliteal fossa is the popliteal artery. Superficial and lateral to the popliteal artery is popliteal vein. In its inferior part, it receives the small saphenous vein. Sciatic nerve divides into the tibial nerve and common peroneal nerve at the superior angle of the popliteal fossa. So lateral to the popliteal vein is a tibial nerve, and lateral to the tibial nerve is a common peroneal nerve. The common peroneal nerve lies in close relation to the long head of the biceps femoris, and it ends by winding around the neck of the fibula. In the popliteal fossa, the common peroneal nerve gives a branch called the lateral pseudocutaneous nerve, whereas the tibial nerve gives a branch called the medial pseudocutaneous nerve. Various deep popliteal lymph nodes are also present in the popliteal fossa. Diagram, the relative position of these three structures, artery, vein, and nerve, are not so accurate, while in this we have shown that in the upper part of the popliteal fossa there is a relation that artery, vein, and nerve. From medial to lateral side there lies artery, vein, and nerve, and then in the lower part and middle part there lies the nerve, vein, and artery from medial to lateral sides.